Did you know colorectal cancer can affect young adults too? It's a sobering thought, but it's true. Every year, thousands of young adults are diagnosed with this disease. It's not just something that happens to older folks. The numbers are rising, and it's becoming a pressing health concern. This is not meant to scare you, but to inform and prepare you. Knowledge is power, right? So, let's arm ourselves with the right information. Surprising, isn't it? Let's delve deeper into this. When we talk about colorectal cancer, it's crucial to understand the facts. Let's start with the hard truth. Colorectal cancer is on the rise, especially among young adults. In fact, recent studies show that those born around 1990 have twice the risk of colon cancer and 4 times the risk of rectal cancer compared to those born around 1950. That's a significant increase, and it's a trend that's projected to continue. It's also worth noting that this type of cancer doesn't discriminate. It affects both men and women across all races and ethnicities. Now, you might be wondering, what are the risk factors? Well, they include a family history of colorectal cancer, certain genetic syndromes, a diet low in fiber and high in fat, lack of regular physical activity, obesity, alcohol consumption, and tobacco use. So what about symptoms? They can vary, but common signs include changes in bowel habits, persistent abdominal discomfort, rectal bleeding, weakness or fatigue, and unexplained weight loss. However, it's important to note that symptoms can often be subtle and easily overlooked, which is why early detection is so vital. That brings us to the next point, the importance of early detection. When caught early, the survival rate for colorectal cancer is about 90%. However, if the disease is found late, after it has spread to other parts of the body, the survival rate drops dramatically. This is why regular screenings, such as colonoscopies, are so crucial. They can detect the disease in its earliest stages, even before symptoms appear. These facts illuminate the gravity of the situation, but what can we do about it? The key to battling colorectal cancer lies in prevention and early detection. It's a battle, yes, but one where you have more control than you might think. First off, let's talk about prevention. You can significantly reduce your risk of colorectal cancer by maintaining a healthy lifestyle. This includes a balanced diet rich in fruits, vegetables, and whole grains. Regular physical activity is also crucial. Aim for at least 30 minutes of moderate exercise most days of the week. And of course, limit alcohol and avoid tobacco. Now, on to early detection. This is where regular screenings come in. You might be wondering, what exactly is a screening? Well, it's a medical test that checks for signs of disease before there are any symptoms. There are various types of screenings for colorectal cancer. The most common ones are colonoscopies and fecal occult blood tests. A colonoscopy allows doctors to examine the entire colon, while a fecal occult blood test checks for hidden blood in the stool, which could be a sign of cancer. Regular screenings are vital because they can catch the disease in its early stages, when it's most treatable. Remember, the power is in your hands. You can take steps to prevent colorectal cancer and detect it early. Prevention and early detection can save lives. But what if you're already diagnosed? A colorectal cancer diagnosis can be daunting, but it's not the end. In many cases, treatments are available and they're continually advancing. From surgery to radiation, chemotherapy to targeted therapies, there are numerous paths that can lead to recovery. But treatment is just one facet of this journey. Emotional support plays a vital role too. Friends, family, support groups, online communities, all these can provide comfort and understanding that can make all the difference. Then there's life after treatment. It may seem distant, but many survivors lead fulfilling, normal lives post-recovery. Take John, for example, who after beating colorectal cancer completed his first marathon. Or Lisa, who used her experience to become an advocate for early screening and prevention. Their stories are testaments to the resilience of the human spirit and the power of hope. They remind us that colorectal cancer is a battle, but it's one that can be won. Remember, you're stronger than you think. Together, we can beat colorectal cancer. To summarize, colorectal cancer is a growing concern among young adults. We've touched upon its increasing prevalence, underscored prevention and early detection, and offered hope for those diagnosed. Stay informed, stay healthy, and remember, knowledge is power when it comes to battling colorectal cancer.